What are the panel's views on local support groups becoming involved with the lobbying of organisations about future testing regimes rather than caring for and supporting their current members in daily life? Okay, so panel's views on local support groups like ours. Should we be getting involved lobbying other organisations, lobbying governments, lobbying political parties, maybe? Or should we be spending all the money on our members and their welfare? Good question. Peter, could we start with you on that one, please?
Yeah, I mean, I think the problem with the situation is that we haven't got a national screening programme. So until we have a national screening programme, funding for other organisations like the hospitals, general practice, all the testing doesn't follow all the work that you could do. So that's the ideal answer, is if there was a national screening programme which could follow, which therefore funding could follow for all the other things. So to me, that's a very important role. You know, writing to MPs, NICE is obviously a massive organisation that we can only really go by what NICE recommends as GPs. So we will follow what their guidance is in terms of screening, and there isn't a screening programme. So I do think that the bigger picture here is if it could be a national programme, that would help us an awful lot.
Yeah, I echo that really, because as it stands at the minute, the guidelines are very conflicting for us as health practitioners. So obviously we have the National Screening Committee not recommending it. Obviously Prostate Cancer they've done a lot, haven't they? And they're doing the trials now going forward with the MRI screening, which I believe, is going to be the way forward really. But it's very difficult for individual organisation, they've got to come together. But there is a role, because women have been very vocal, haven't they, in their menopause work that they've done. So my other colleague is a women's health lead and menopause lead. So, that's really through lobbying and lots of public figures really, come now into organisation. She's linking in, and we're going into practices to support staff and to engage with staff on menopause training. So I don't see why there shouldn't be a similar sort of strategy in men's health as well.
Yeah, I probably won't open the screening discussion quite yet, as it's too early. But I know it will come, and we all have our own views on it. But like I said earlier, I think groups like yours are so powerful. If government and the decision makers are going to listen to anybody, they're not going to listen to doctors. There's a track record of that. We've seen it. But they will generally listen to patients. So you have to go and continue to vocalise and express your desire to see the very best for the men of Worcestershire and their families. And that means resourcing this county properly. I don't think we get enough of a slice of the cake for the overall funding for the NHS for what we have here. We have one of the highest diagnostic rates within England, I am sure, per capita. But I don't think we're resourced for that from the centre. So there is this thing called the ICB and the ICS. And again, I know somebody very senior in that ICS has got a contact with prostate cancer. Everybody knows somebody, don't they, virtually now? Which may be a good thing. I don't know, in a way it's a bad thing, but of course it's a good thing that there's more awareness and more diagnosis and more treatment. So you have to go to the key decision makers, the opinion leaders, and try to influence them. And that's, as I've said, something really important, the patient's voice.
Right. So in other words, you're saying, some of the money that comes in, shall we say, to our organisation, should be spent, if you like, on that lobbying process. You think, as long as there is a balance.
Well, I don't know if there is a lobbying process.
Yeah. I think through the likes of Tackle and Prostate Cancer UK, yes, I think there, but not perhaps at the local level so much. Yeah.
So I think if you don't ask, you won't get, and in the north they say shy bairns getting out. So you do have to rightly or wrongly, and there's the argument about screening and PSA testing, etc., etc., etc. But if you park that, you've got to look at, well, who's listening to you and in what forum and in what capability can they change anything. So talking to me and saying we need another MRI scanner, I may not be able to change anything there. But if you go and speak to the chair of the ICS, something might happen.